Yeah, so dry needling is using a small monofilament type needle, similar to an acupuncture needle, and we identify a tight band or a band that radiates pain or causes dysfunction. We insert that needle into that band to get a local twitch response or to get a reaction in that muscle, and that typically leads to decreased tone, decreased tension, improved pain, and improved movement. We don't necessarily have an explanation, but we have a few theories. And so one of the theories is that it changes that dysfunctional area where the nerve comes into the muscle, that we're actually disrupting that section with our needle. Another theory is that we're changing the nervous system, and that has been supported in some studies. Also, just in clinical practice, if I needle someone's right hamstring, sometimes their left hamstring length improves. And to me, the only way to explain that is there's got to be something happening either at the spinal segmental level or at the brain level. I can really only speak to trigger point dry needling as far as their effects, but in acupuncture, it's more of again, it's a different system. It's just a different system of use of that needle. So I think they're both techniques that use a monofilament, and so they both use the same tool, but they're different philosophies, they're different treatments, and they're different evaluations, and with different effects. And I go out of my way to tell people I'm not doing acupuncture because I'm not trained in that. Yeah, so it's really patient specific. An acute injury a lot of times doesn't need that many sessions to recreate that normal pattern because they have an acute change, they need to get that pain and guarding down, but they bounce back really quickly. Also, athletes or younger patients tend to respond a little quicker with dry needling. People that tend to take longer are people with chronic pain or people that have had significant changes to their joints or that have had pathways that have been dysfunctional for a long period. My business partner had shoulder surgery and I was having trouble getting his range. He went to the course, he came back full range. And so I said, well, I need to check that out. And so I took the courses, and it's just one of the more powerful techniques I've learned.